So I told myself I wasn't going to use until I went over there and ate. But by time 11 o'clock came, I was already high.
When I got back to my room that morning, I'm sitting there looking out the window and I could see the kids going to school, and I got to think to myself, if I don't get this mental illness and this substance abuse issue under control, I'm going to spend the rest of my life here and I'm going to die here.
I was actually outside and I heard a thump in the house, which wasn't unusual, and my daughter came running out and she said, "Jordan's having a seizure."
I was in a bad relationship, and we broke up, and I was with some friends, and I was really depressed, and they asked me if I wanted to use some methamphetamines, and I used it, and it made me feel a lot better. I was more energetic, and I kind of numbed my feelings. And my lowest point was probably when I got in trouble and caught a charge. And the lowest point was during that time I was going to court for my charge, and I ended up having to go to jail. And my dad was dropping me off to go to jail, and he started crying, and it was really hard to walk off to turn myself in while my dad was crying, and I'd never seen him cry before, and that was really tough for me to let my parents down. I realized I needed help. Well, I got sent to rehab for court, and I didn't really think that I needed to go, but once I was there, I realized I had a problem and needed the help. So I took everything that I learned at rehab and used it in my life and started to turn my life around, and that's when I realized that I needed that help and to help myself. Bad and depressed there, but like I said, I took the time there to better myself, and I took all the resources that they had for me to decide to better my life. And so I stayed there for 34 days and learned a lot about my mental health and my substance use disorder. And that's when at 34 days I got out of rehab and feeling a lot better, and I was sober and ready to finish court and do whatever it took in probation and parole to get off of probation and finish, continue my life being sober. So after I got out of rehab, I got sentenced for probation and parole, and I got 5 years probation, and it was for SIS, which was the suspended imposition of sentence, which means my felony would fall off my record after I got off probation. So I decided I was gonna put my butt in gear and jump through all the hoops that they had for me, which I was on a curfew, had to go to 2 meetings a week, and attend outpatient at Preferred. And I was gonna do all that and make sure I attended all that to make sure I could get through probation as quickly as possible. So I did that, and while I was attending Preferred for outpatient, I started counseling, and I worked on my mental health a lot, and it helped me a lot. So that's when I just was talking to my counselor, and she thought that since I liked helping people so much that I would be a good fit for the peer specialist position because of what I'd been through in my life and what the position entailed. So I started sitting in on groups and seeing if I'd like the position and if that was something that would be fit for me. So and I really liked it, and I thought it was something I would like to do. So that's where we are today. I'm Katie Snyder. I work for Preferred since September now, and I have a substance use disorder, and I'm in long-term recovery.
The first time I started using, I had been working at the old Levering Hospital, and 2 hospitals were starting to merge, and so I got laid off on the second layoff. And I was very, very depressed that evening, and I was out riding around, and I ran into some friends of mine, and I was telling them what was going on, but I was also letting them know I was really down about it. And one of my friends told me, he said, "Well, I got something that's going to make you feel better if you want to be boosted up." And I said, "Sure." I said, "I don't want to stay feeling like I did." And they had some cocaine with them. And so we drove down a country road. They whipped out a meal. The point in my life was that I had got a guardian because they kept telling me I wasn't able to care for myself. And because I was out drinking, I was using crack cocaine, I wasn't taking my medication half of the time. I got really severely depressed one day, and I started drinking real early in the morning. I started smoking crack, and then I thought, well, you know, maybe if I take some of this medicine, it, you know, would help me out. So I took some of the medication, and I took more than what I really should have, and I actually overdosed myself. And so I was placed in a psych ward, and I was there for 30 days. And then my guardian was really worried that, you know, if I kept going like I was going, that I was going to die. And so my guardian placed me in a lockdown mental health facility. And that was the lowest time ever in my life. One day that I needed the help because while I was living in the lockdown mental health facility, there was like 5 of us that sat at the table every day at the same time. And we had breakfast, lunch, and dinner together. And there was a guy sitting at the table there, and his goal was to get off the skills side, go to the RCF side of the home, and then eventually going out into a residential and eventually getting his guardianship and living on his own. And that morning when we all went to breakfast, he wasn't there. And so we kept asking questions, where is he? And so eventually the nurses told us to stay after we got done with breakfast. Well, they came and told us that he had died during the night. They didn't tell us how or anything, they just said he had died. So when I got back to my room that morning, I'm sitting there looking out the window, and I could see the kids going to school, and I got to think to myself, if I don't get this mental illness and this substance abuse issue under control, I'm going to spend the rest of my life here, and I'm going to die here. After I was in lockdown facility for 60 days, I was doing a lot better, and so my sister let me go back home. And when I went to Preferred Family, they had started a brand new program there, and it was called Treating People with Co-Occurring Disorders. I asked the program director if I would be someone that could, you know, qualify for it. He said, yeah, you definitely achieve. So I went into my first meeting, and they were reading out of a book, people that had mental illness and also substance use disorders, and how if you worked on both of them at the same time, that you could recover. And so it really struck my interest because all the stories they were reading, you know, it sounded just like different parts of my life, things that I had been through. And so I talked to the lady, Nancy Perry, that was over the program at that time, and she said, well, come back tomorrow, and there's going to be more that we're going to be working on. So I got into treatment at Preferred, started going Monday through Friday, and I went faithfully. And working on my co-occurring disorders, it really changed my life. I've been involved in the co-occurring program, and there was part of the program called Dual Recovery Anonymous. And it's kind of like an AA, NA, and everything combined, but also you bring in the mental health side of it. And so I actually got to start running that program. And I thought it was very, very interesting. It fit so many people's lives that we had into our program. And so as the more I did the Dual Recovery Anonymous meetings, that I was asked if I would like to go to training to learn more about, you know, co-occurring disorders. I started going into training, and we used to go every 3 months for 3 days. I met with some of the most wonderful psychiatrists throughout the United States that mainly worked with co-occurring disorders. 2 years into recovery, there had been a new program started in the state of Missouri, which was called Certified Missouri Peer Specialist, where you take a client or consumer that has life experience and you send them to training. We trained for a week, very intense training, and then we would go back to the facility that we were at and also go to work there. And so since I had a lot with substance abuse, mental illness, that Preferred offered me a job. So I started working out part-time. I took a state test, passed the state test, got my credentialing. Then I started working with other individuals just like I am. And I got to share my story, to let them know, hey, you're not alone. There's more people just like us out there. I've been working for Preferred Family Healthcare now for 8 years. Over a year ago, I was offered a full-time position. I work with the 120 program with probation and parole. We have people at probation and parole come to our facility for services, and then also I go to the probation and parole in the afternoon and run groups down there. Over the last several years, I became a foster parent. I had 2 children that came into my life. I ended up being able to adopt them. Now I'm a parent today. And my life today in recovery is fantastic. Everything I ever wanted to do in my life came true once I got into recovery. And I am Bruce Charles. I'm a Missouri Certified Peer Specialist, and I work at Preferred Family in Hannibal.